Bismillahirrahmanirrahim. Okay, gentlemen, now we are going to talk about vasculitis, of which there are different forms. Um, um, there are few individual types of vasculitis which are important to remember with respect to exam. But first, um, and there are particular clinical features you need to remember for each type. Now, vasculitis can be primary, it can be secondary. Primary is usually non-infectious, okay, immune-mediated, and secondary vasculitis occurs due to some infections. Another way of classifying vasculitis is according to the size of the vessel. Uh, that is, as either as it can be divided into three groups: small vessel vasculitis, medium vessel, or large vessel vasculitis. Okay. Um Granulomatous diseases like giant cell arteritis and Takayasu arteritis fall under the category of large cell vasculitis. Kawasaki disease, polyarteritis nodosa fall under the um, category of medium vessel, and small vessel vasculitis includes a lot of diseases. For example, microscopic polyangitis, Strauss syndrome, the important ones, SLE, etc. Okay. A question can be asked that classified according to the size of the vessel. The range of ways a question regarding vasculitis can be asked. Now we start off with the with a very important type with respect to paper, known as the giant cell temporal arteritis. Now remember that giant cell tem- you can guess a few things from the name. One giant cell and the second temporal. Okay, by temporal here we mean that it affects vessel in the temporal area, and giant cell is with respect to morphology. Now we've already got the info that it includes large size vessels mostly, but small size vessels can be involved. Okay, and why small size? That a large vessel may be affected and its branches get affected um, consequentially. Okay, now in case of giant cell temporal arteritis, aorta and the vessels of head and neck are most commonly affected. Okay, this is a very important point to remember, that aorta and vessels in the head and neck, particularly the temporal vessel, the vertebral vessel, and the ophthalmic vessels get affected in cases of giant cell arteritis. Now, moving on to the clinical features of this disease, remember that this is rare before the age of 50. Okay, it is very rare before the age of 50. So, in a clinical scenario, you're likely to get a person well in the fourth, fifth, sixth decade. And then, as mostly the vessels in the head and neck region are affected, facial pain and headache is one symptom. When it affects the ophthalmic vessels, diplopia and vision loss may be another feature. And then vessels in the temporal area get affected. Palpation of the affected vessel is painful. This is a very important point to remember. Now, as we said, there will be some giant cells. In the morphology, you can see here there's a multinucleated multinucleated giant cell, which is affecting the wall of the vessel, destroying it, and the inflammation, the granulomatous inflammation, is destroying the wall of the vessel completely. This is a special stain that shows the damaged internal elastic lamina in this region. Okay. Um, Now, another important disease, Takayasu arteritis. This also affects medium and large sized arteries, classically aortic arch in the and its vessel. Okay, remember this point: aortic arch in vessels. It also leads to ocular disturbances. Okay, ocular disturbances can also be seen in this disease, and then weakening of the pulses in upper extremities as it affects the aortic arch and its vessels, and the vessels arising from the aortic arch. We've already established that if a large vessel is affected, its branches may get affected consequentially. So this leads to weakening of the pulses in the upper extremities. Okay. When the vessels in this region get affected, there is reduced upper extremity blood pressure, okay, and pulse strength. This is natural that when the vessels in the supplying the upper arms get affected, there might be some reduced upper extremity blood pressure and pulse strength as well. And but there are other features as well, as ocular disturbances, including vision loss. We know that ophthalmic vessels can get affected in this disease. And then less common features are pulmonary hypertension, leg claudication, myocardial infarction. These are lesser important features with respect to your exam. Important things are reduced upper extremity blood pressure and pulse strength, including faint carotid pulses. Okay, and then ocular disturbances. Now this is an imaging capture of the aortic arch. Here, this is the aortic arch, and these are the vessels arising, and you can see in this area there's some narrowing that has been shown, showing the classification of Takayasu arteritis. This gross picture shows the narrowing of the vessels. This again shows you the multinucleated giant cells, the granulomatous inflammation affecting the vessel. Polyarteritis nodosa is an important disease after the ones we have discussed. Affects small and medium-sized vessels, particularly in the kidney and then other viscera, but kidney is the most important one. And uh, important point to remember is that this disease spares the pulmonary circulation. Pulmonary circulation is not affected usually. We'll see which type of vasculitis is more important with respect to lung shortly. Then the next important point to remember with respect to PAN is that there is segmental transmural necrotizing inflammation. Segmental means that different segments of the vessel are affected. Transmural, throughout the thickness, necrotizing inflammation. Areas of necrosis can be seen. We'll see shortly how they look like. We said that it affects a lot of viscera, particularly the kidney. So vessels of the kidney, heart, GI tract, many areas can get affected. However, it is episodic and it affects young adults. Okay, this is how it looks like. There's fibrinoid necrosis. This is it can cause thrombus in the lumen. You can see lumen is almost obliterated by the disease process, and can be seen. And different stages of a disease can be seen in different areas. Kawasaki disease. I've seen a lot of scenarios in MCQ books regarding Kawasaki disease. They frequently ask, particularly in the particularly in exams outside of Pakistan. Um, it's usually acute, self-limited, but very important point you have to remember is that it affects the infants and children mostly. Okay, infants and children. Remember this point with respect to Kawasaki disease. Infections, it is said, mostly viral, may consider a trigger in hypersensitivity response. It affects children. One most important thing, and the second most important thing is that it affects the vessels of the heart. Okay, MI in the child, in a very young child, is highly unlikely. That it's highly unlikely that it's due to atherosclerosis. Okay, so it's a very important feature. Coronary arteritis leading to infarction in a very young child. It can clinically present as a desquamative rash, another important feature, and it can present as a cervical lymph node enlargement as well. Okay. Morphologically, it resembles pan. You may see some areas of fibrinoid necrosis, etc. But there's lesser degree of it in this disease as in comparison to pan polyarteritis nodosa. Next important disease is microscopic polyangiitis. This also presents like pan. This also presents with necrotizing vasculitis. You can see, but important point to remember is that in a given patient, the lesions are of the same age, which was not um, the case. With pan, it can affect skin, mucous membrane, brain, heart, GI, lungs, kidneys, but lungs and kidneys are the most important areas you need to remember with respect to this disease. And serologically, these antibodies can be checked. These are very important to remember. ANCA, anti-neutrophilic cytoplasmic antibodies, which can be detected when we are trying to make a diagnosis of this disease. But the MPO type, we'll see another type shortly in another disease. Clinically, we've seen that most areas, the important areas to remember are the lungs and kidneys. So, with respect to that, you must remember at least hematuria, proteinuria, and hemoptysis with respect to clinical picture. But it can affect other areas as well. So, abdominal pain, bleeding, muscle pain, etc., and palpable cutaneous purpura can also be seen. This is necrotizing inflammation. There are tiny blue dots like this one showing that these are the karyotic debris. Um, um, the nuclei are almost gone, um, and you can see this just might the vessel lumen is not visible, but it has almost completely destroyed whatever vessel there was in this region. Okay. Granulomatosis with polyangiitis also presents with necrotizing granulomas, but important thing to remember is that it affects the upper respiratory tract, ear, nose, throat, and sinuses. Okay, it can affect lower respiratory tract as well, but and both as well. But remember at least the upper respiratory tract, and then there is granulomatous vasculitis affecting small to medium-sized vessels, most prominently lungs and upper airways. That's why I said that most important to remember is the upper respiratory tract that gets affected in this disease. Okay, and some and in many cases, glomerulonephritis can occur. That is when the kidney gets affected. This was the type of ANCA I was talking about, PR3 ANCA. You can you can get an MCQ where a particular type of ANCA is asked with the given scenarios. Remember where PR3 ANCA is positive and when MPO ANCA is positive. Okay. As it affects the at GPA, dermatosis polyangiitis affects most prominently the vessels in the upper respiratory tracts. So it may present with chronic sinusitis, around 90% of the cases, but many cases present with nodules and cavitary lesions in the lungs as well. Okay, and then we talked about glomerulonephritis, renal disease in 80% of the cases. And the fourth point to remember is mucosal ulcerations of the nasopharynx. These are all important. All four of these are important, but remember cavitary lesions in lungs, chronic sinusitis, nasopharynx ulceration, or renal disease. This is how it looks like. You can see this is a lung and this is a cavitary lesion here. This is another lesion here. There's a small cavity here in this area, and this shows the microscopic picture. This is a giant cell here. There's some granulomatous process going on, histiocytes and lymphocytes. A chronic process is going on. Some granulomas are being formed, and you can see a prominent giant cell. Schuch-Strauss syndrome. Uh, is another type of vasculitis that affects the respiratory system and is associated with asthma and allergic rhinitis. Okay, but what differentiates it uh, with respect to lab investigation from the disease we have previously discussed is peripheral eosinophilia. One is clinical feature that presents with asthma and allergic kind of features. Then there are lung infiltrates, but along with that, there's peripheral eosinophilia, increased eosinophilic count in the peripheral blood, and then extravascular granulomas can also be found. Okay, um, some cases when it gets advanced may lead to cardiomyopathy as well. But remember, this is not in a child. We've talked about a child. Kawasaki disease is still the most important one with respect to infants and young children. Thromboangiitis obliterans. The most important things you need to remember about this type of vasculitis is that it affects principally the tibial and radial vessels. Okay, in tobacco smokers. Okay, this is the scenario you're most likely going to get a disease, an inflammatory condition affecting the vessels in the vessels, um, that is the tibial and radial vessels, and the person would be a smoker under 35 years of age, under 40 years of age, and so on and so on. This can result in a cold-induced Raynaud's phenomena. Clinically, one may have foot pain induced by exercise. However, in other cases, there may be severe pain even at rest. Okay, important point with respect to therapy is that smoking abstinence in early stages can reduce the clinical symptoms, can reduce the disease, can reduce the advancement of the disease in these patients. So this is how it looks like. You see this is a vessel, normal lumen, wall, everything is gone. There's alpha inflammatory activity going on that is destroying the vessel wall. So this is it for now regarding the most important points with respect to vasculitis. Please let me know if you have any questions. Signing out for now. Thank you.